Okay, good evening, everybody. Welcome to another Medical Projects webinar. It's great to have you with us this evening. Thanks for joining. We were just waiting for the last few students to join there, so thanks for your patience. My name is Mark Williams. I work here at Medical Projects, and we help students with their medical school applications. And we've been running this kind of free webinar series since the first lockdown last year, and they've been really popular. So yeah, thanks for joining us this evening. Cool. So tonight we're going to be looking at what makes a good doctor. It's quite a common question students ask themselves. It's quite a common question that's asked around interview times as well. So we just wanted to run a webinar, but get some slightly different perspectives on this question. I'm sure you've probably read lots of articles and maybe seen other videos and webinars about this topic, but we wanted to look at it from a couple of different angles. We want to give you the reality of being a good doctor and what it takes to be a good doctor. And we're also going to look at it from the perspective of a nurse as well. And we think that's going to be quite interesting because, you know, you're not just working in isolation as a doctor. You have to work with quite a lot of people. So we're going to talk to and get a nurse's opinion as well. Just some quick kind of housekeeping things before we get going. We will finish this webinar before 8 o'clock. We appreciate doing a webinar on a Wednesday evening. We don't want to take up all of your time, so we'll try and fly through this as quickly as possible. We will send a recording and a copy of the slides out within the next kind of 48 hours as well, probably some point tomorrow. So you don't have to sit there and try and scribble all the notes down. We want this to be really interactive as well, so we will be using the Q&A kind of tool at the end as well. We'll try and make sure there's about 20-25 minutes time for you to ask questions. When you're using the Q&A system, we use something called the upvote system. Essentially, you can hit there's like a little thumbs up button next to a question. So if you have that question or you want that question answered as well, you can kind of vote, and then we can see the most popular questions, and we can try and answer as many of those as possible in the limited time we have. We have a poll question as well that we always kind of ask during our webinars. It's just to kind of gauge who is kind of watching and joining our webinar. So I'll just quickly launch that now. So that should pop up on your screen. Again, it's just to give us an idea of who's coming back to our webinars, and if people are actually enjoying them. If we see the numbers kind of going down for people that aren't coming back, then we need to do something different. So I'll just give everyone a second just to vote on that. Cool, looks like most people have voted now. So I'll quickly share the results. It's all anonymous, so it's just in a chart. So yeah, 45%, this is your first webinar, so big welcome to you guys, which means the other 55% have attended a webinar before, which is great. It's great to have you back. It's great to have that many people hopefully enjoying our content and coming back, so appreciate it. Right, okay, let's get on with this. So what makes a good doctor? I think this would be a really good time to introduce our doctor, who is Dale. I don't know if you're there, Dale.
Yeah, I'm here.
Hi, how are you doing?
Yeah, very good, thank you. How about yourself?
Yeah, very good, thank you. Do you just want to kind of give everybody just a rough idea of your background and kind of where you're at in your journey as a doctor now?
Yeah. Well, I grew up and went to school in Doncaster in Yorkshire. I went to university at Sheffield and then went on to do F1 and F2 in Yorkshire as well. I'm currently working as a general surgical doctor in Bath, in the Royal United Hospitals in Bath, and I also work in medical education as well. Yeah, that's it so far, really.
Okay, perfect. And then we're going to get a slightly different perspective on this topic as well tonight, from Isabel, who is a palliative care nurse. I don't know if you're there as well, Isabel.
Hello.
Hi, how are you doing?
Yes, very well, thank you.
Yeah, same again. I mean, just generally, do you want to give the students just a brief overview of kind of where you're up to in your journey now as well?
Yep, so I studied, I adult nursing at the University of Lincoln. And then I've had a couple of different specialities since I graduated, varying from like A&E most of my career. However, now I'm working in palliative care in a hospice, and I think this is where I want to specialise. So that's where I'm up to at the moment.
Okay, fantastic. And I'm sure you've obviously worked alongside and with a lot of doctors in your time as well. So I'm sure you've got some good stories and some stories that people can learn from as well. Let's put it that way.
I do, definitely.
So that'll make a different perspective on this topic, because I think a lot of people might have just seen people talking about this from the doctor's perspective. So it's really good to have you here this evening. So yeah, thanks for joining us.
No problem.
Cool. Yeah, I don't know if we want to start with you, Dale. I don't know if you want to just kind of give your ideas or your opinion on this kind of topic as a whole.
Yeah, no worries. I've got some slides.
Yeah, okay. 1 second, I'll stop sharing my screen. Might need to make you a co-host as well. 1 sec. There we go. You should have the ability to share your screen, I think, now.
Lovely. Okay, is that there? Is that working?
Yeah, I can see that.
Okie dokie. So Mark's very kindly introduced me, and I've already told you where I work and where I graduated. So we'll just crack on. So what makes a good doctor? Good medical practice is a document which the GMC outlines core guidance for doctors. It sets out the values and principles on which good practice is founded. My main recommendation is to read this document front to back. It's 40 pages, but there's only about 20 pages or so of content. And I'd expect all applicants to medical school to at least be aware of this document and probably have read it. Today, I'm just going to merely mention it so you know it's there and recommend that you read it. And I'll discuss behaviours and characteristics which I've witnessed and believe to make a difference in the real world kind of day-to-day practice as a doctor. Communication skills. I don't really want to spend too long on communication skills, because I think if I asked you all what you thought the most important feature of a doctor was, I'm sure many of you would say communication skills. Most medical complaints are born from poor communication skills. And should you go on to medical school, you'll go through extensive training on how to communicate, take a history, and discuss difficult topics like breaking bad news. But areas where I kind of see a lot of people going wrong with communication is communicating without respect. Most of the time, this is often due to kind of work stress and work pressures that are often unseen by the other member of the discussion. This has been made kind of worse in the last couple of months with the COVID pandemic, and placed very, very different communication constraints due to things like PPE. All I would say is it's a good thing to try and reflect on is have a think about how you communicate with people, how your body language affects communication, how your facial expressions affect communication, and come up with tactics to respectfully communicate with other members of the team, and recognise when the communication scenario is kind of going sour and how to change that experience. Self-awareness. Self-awareness is how an individual consciously knows and understands their own character. This includes, an awareness of their ability and limitations, and all the things that I've noted down in the slides. This is clearly a hugely important topic for doctors for a number of reasons. For example, I'm training to become a surgeon, and I have to learn how to operate on patients and perform different types of operations. And as you well imagine, there's a fine balance between training new generations of doctors and ensuring no harm comes to patients. From my point of view, it's really imperative that I'm aware of my skill set and abilities, and I'm honest with my trainer, so they know how to best supervise me. It's also important to be honest and kind of highlight to your teacher how you feel if you do not feel you have the right skill set to perform a task, and ensure no harm comes to your patients. Being aware of your strengths and weaknesses is imperative to every medical professional. It's a basic human instinct to play to your strengths, and it can be extremely difficult to address your weaknesses. I'm sure all of you have particular areas in your studies that you find hard, and I've always found areas that I'm weak in, areas where I don't really want to study. However, in medicine, it's important to identify these areas so your practice can be improved and certain skill sets that can be improved so you don't harm anyone. I think one of the most important things to be aware of is the fact that you are actually a human. It's something we occasionally forget in stressful environments. I'm sure Isabel will probably agree with that. The pressure of constant bleeps and phone calls and sick patients 24 hours a day, 365 days a year can give you the impression that you're climbing a huge mountain that just keeps getting bigger. However, it's important to recognise that you need a rest, and taking 10 minutes and having a drink and something to eat can often give you a second wind in your shift and make you perform more efficiently as a doctor. How do you become more self-aware? The best doctors and the best students I've ever worked with are people who demand often and high quality feedback. Many people shy away from feedback in areas of life, in all areas of life, because it's sometimes hard to hear, and it can be associated with feeling negative. This is particularly true when someone delivers bad feedback to you. However, it's important to remember that that feedback is just feedback, and you can disagree with it or challenge it if you think that it's not relevant or helpful. However, I think it's particularly useful to get as much feedback as you can, because this can highlight certain themes which can be useful to address that you might not know yourself. Reflecting is kind of key for experiential learning by your experiences. Everyone reflects on their experience, probably unconsciously a lot of the time. As you go on through your training, you find that it's mandated a lot of the time that you have to complete formal reflections. This is something I've never really liked doing, especially in university in my F1 and F2 years, where I was mandated to do 30 reflections a year. But however, since I've got a bit more senior, I found it something really, really useful, just to, if I had a particularly, emotionally stressful situation or something that I found hard to deal with, just to write some notes and try and reflect on that experience, just so I'm better prepared to deal with that situation in the future. And I can go back and reflect on my notes that I've made in the past. It's a really useful tool. One of the biggest lessons I've learned from my time as a doctor is mistakes are one of the, if not the most useful opportunity to become a better doctor. Again, being human means that we will all make mistakes, and all doctors will make mistakes. Thankfully, most mistakes are small and have little consequences. An example of a mistake I made is I took a set of bloods once from a patient in a bay who had a similar name to another patient in the bay, and obviously put the wrong stickers on the wrong set of bloods. But as such, I put my hand up, admitted to my mistake, apologised to the patient, and escalated to my consultant. And as such, I've never made that mistake again, and I'm really consciously always checking that I'm taking bloods off of the right patients. Highlighting mistakes is particularly important in the process of improving the quality of the service that we deliver. It can help trust to develop, to see and develop patterns of errors and put in barriers to stop these mistakes happening again and again. A particularly good example of this, something that I use on a day-to-day basis in my work, is the WHO surgical checklist, which is a really good example of something that you could read up about in preparation for interviews. And it's essentially a safety checklist before we go to theatre. I'd highly recommend you having a read up about it. The danger with mistakes is not admitting to your errors or trying to cover it up. And this is one of the areas that the GMC are particularly care about, and will deliver heavy punishments if anything like that happens. Motivation, in my opinion, the best doctors are motivated doctors. Motivation comes from many places and is influenced by many factors, but in my opinion, it's pretty much self-driven. First of all, I'd be lying to you if I said that being a doctor wasn't stressful at times, and I can imagine you can all appreciate that if you considering going into it as a career. Something that has served me well in my career so far is identifying areas which I find stressful and trying to come up with tactics to help manage that stress. For example, I find paperwork, doing audits, doing research, and things to improve my portfolio and CV are things that I find really boring and B, quite stressful. One way I've tried to address that is to specifically timetable it into my week and set aside short blocks of time and space it out across the week to ensure I've got time to do it and I have no excuses to do it. There are other things that are a bit more difficult to plan for to a certain extent, such as dealing with emotionally taxing aspects of a job, like delivering bad news or dealing with patients who are dying. And many of the ways we deal with these issues is by having hobbies and escapes and ensuring you have time to get away from work. For example, music, sport, seeing friends are all good tactics of stress relief. I think an important aspect to maintaining your motivation is pursuing your interests inside medicine as a career and taking opportunities to experience different aspects of all different careers inside medicine. There are ample opportunities both inside medical school and out when you have time to do this. Examples are student-selected placements at university, intercalated degrees where you can go and experience research or other areas of science, elective placements where you can go abroad and experience other healthcare systems, selecting foundation jobs which are appropriate to your interests, and taster weeks when you become a doctor. These are all areas that will allow you to experience different areas and harness your motivation for your career by finding something that you like. The final characteristic I kind of really want to talk about is determination. Everyone will have times in their lives and their career when they doubt their decisions about what they want to do. This is completely natural. And if you are sure you want to go on to do medicine or want to go into a certain speciality, don't give up. I've had loads of knockbacks in my career so far, but I've addressed these issues as I can and worked as hard as I can. And as such, I've had many more opportunities that have opened up as a result of things not necessarily going right the first time. Many of the doctors I know have had knockbacks in their career and gone on to bigger and better things. So if things don't work out initially, reflect on it and try again. Time is really not an issue. That's kind of all. We could talk about this all day long, but that's kind of the only things I kind of wanted to say initially. And I'm happy to take any questions when the question panel is going.
Yeah. Oh, thank you very much. There were a couple of things in there that you mentioned, like links to the WHO surgical checklist. I've actually got links for those, so I can paste those into the chat box for the students as well. Like how many years training have you had now? So from say first year of medical school up until now?
Oh right, so 5 years of medical school and 2 years of foundation years and 3 years of just pure general surgery. So 10 years.
That's 10 years of training where you're essentially given structures to reflect and to identify your own weaknesses, and like you said, it's mandated. You have to do this reflection to progress in your career, don't you?
Yeah, exactly.
So I mean, the students that will be kind of sat at home watching this won't have anything like that structure yet. So how would you kind of recommend that they start that reflection journey or identifying their weaknesses, because they haven't got a structure yet from medical schools?
Yeah, that's completely understandable. And actually, I think in reality, the structure is sometimes not ideal for what the areas that you'd want to reflect. So what I would suggest is you can start by identifying any areas in life in which you find that you can find taxing or emotionally difficult. And it's sometimes easy sometimes a good exercise just to write down a few notes or something like that and reflect on them over time. It's a good idea to sit down with someone. Even at school, it's particularly good to sit down with your teachers and highlight areas that they think that you can improve, and then you've got guidance from other people in which you can help develop. I suppose what I'm trying to say is that the biggest factor is learning to be self-directed. And I think that's one big difference from university and being a doctor from school, that actually there isn't actually as much of a structure as you would think, and a lot of it, which I think it makes a good doctor, is quite self-directed. People often will give you some feedback, but if you want really honest and good feedback, you have to go and seek it. So, it's a good place to start at school, trying to get some more detailed feedback from your teachers and trying to find out areas you can improve.
And you mentioned that communication, it was first in your slides, and you said that it's one of the most essential skills. How do you think, or has your communication skills developed in that kind of 10 years? You don't start off just being a great communicator. It takes time to develop, right?
Yeah, exactly. And I think, it starts off, I mean, some people are, happier to just chat to people before university and things like that, before you go and start having your training. And I think it starts there, actually, just going out, finding out people's stories. And it's good things you can do before you go to medical school, just going and chatting to people and from different areas of life and different paths than you would normally. So I know schools and universities have various different schemes to help do that. And yes, actually, there is a lot of training in medical school. But I think, basic good communication starts before medical school. Basically, just going and chatting to people, learning how to speak to people and speaking to people with respect, I think.
And then, so when you get through medical school, first kind of day one of being a doctor, did you feel like you were a perfectly competent doctor and you were a good doctor at that point, or does that also take time?
Oh yeah, absolutely, yeah. I'd be lying to say that those first few weeks aren't quite scary for a start. Yeah, it's a big change. Everything's a big change. You go from having a nice long holiday once you finished university, often going on your elective placements just before you finish university, not having a time to get up, to having to get up at 8 o'clock, get up and go to work for 8 o'clock, having to set up lists of patients, having to know everything, us having consultants asking you about patients. It's a real change of pace. I think one of the things is that medical school does prepare you for it. Medical school gives you a good idea of what to expect and how to act, so you have a good idea of what's coming. And I think what I said earlier on is everything's quite self-directed, and that's the big difference from leaving school to going to university, is that the more you can take out, the more you get out of university is as much as you put in to a certain extent. So, if you're worried about feeling that you're not going to be prepared, then you can go and do more, see more, try and find out more. And there's literally no limits as to what you can do at university. You can go in all hours of the day if you want to. If you feel like that's what you need, that's what you can do. If you don't feel that you need that, then you can do a little bit less, and it's really is self-directed. So no, but I don't think I felt prepared at the start of being a doctor. But everyone's very supportive and gives you a lot of time, and gives you a lot of feedback, and the first 2 weeks of being a doctor is the most learning I've ever done inside 2 weeks ever. The amount of knowledge that's imparted in those first 2 weeks is crazy. I don't know how anyone takes it in. What they do.
I can imagine, as a nice kind of segue, I imagine that the teams that are already on there, such as the nurses, probably provide quite a lot of help during those first few weeks.
Yeah, exactly. Yeah, the nurses are really key. And you build friendships and with the team that you start working with, and everybody's out to help you. So absolutely. Yeah, that's certainly the case.
Yeah, I just kind of want to get this idea across that a doctor doesn't operate alone. A doctor is a team, really. There's so many people that support that one role.
Exactly. Actually, there's a lot more people in the team that can offer advice and help. So, I mean, I frequently in my job, there's lots of times that I'll go and gain advice from physios, occupational therapists. The healthcare assistants are particularly useful for helping me out in terms of helping me examine patients, helping position patients in such a way that I can examine them appropriately. And the nurses obviously can help you with your assessment of patients, and they're particularly useful to have a nurse with you when you're assessing sick patients as well, because they know, especially senior nurses who know a lot about looking after sick patients, can often add a second pair of eyes, and it's something that you shouldn't ignore.
Yeah, something I hear quite a lot is that the nurses often know more than the doctors coming in, especially when you're fresh out of university. They just have so much more experience than you, and you might think that, you know, you've been through medical school and you should know everything by now. But the people that have been working in hospitals know so much more than you, and it takes time to develop and integrate into those teams and become a good, competent doctor as such.
Yeah, exactly.
Cool. Yeah, this would be a great time to kind of bring Isabel in and just kind of ask kind of what your opinion is on what makes a good doctor as well, because, you know, like we said, a doctor is a team and is not just it's not just one person and one role.
No, for sure. And like throughout my career, I have worked with everybody from medical students, like on their placements, right the way through junior doctors, specialty doctors, consultants, and everyone that you work with everywhere will be different. And I'm sure Dale will appreciate like how you can have good nurses as well as having good doctors. And you can have bad nurses as well as having bad doctors. And it's just about trying to find that right mix of people, and how you quickly find out how people can help you, and also how you can help other people. So that's just really important to bear in mind when you're thinking about just learning about what everybody's role is within that team. So what I wanted to talk briefly about when I was talking about what makes a good doctor, when I was thinking about it for me, my best piece of advice, especially when you're going to be starting medical school, or even just thinking about your application and what to talk about at interview, is making sure that you realize that the patients aren't just charts and what their blood results are. They're not just their like past medical history and what you read on the notes. The notes and the medical history and the bloods and the charts can say one thing, and then you look at the patient and you can see a completely different story. And my biggest piece of advice would be to just look at your patient. And if you think there isn't something right with them, even though the charts are saying something different, then it's probably your gut instinct is correct. And I think that's what you'll hear a lot of nurses say, is something isn't right, or they've just got a feeling about something. And a good doctor will often listen to the nurse's feeling. It isn't always right, but from a nurse's point of view, just to feel like the doctor has taken on board that feeling and is either going to explore it further or sort of reassure you that it doesn't need exploring further, that's a really sort of useful thing for you to start practicing when you start to go into your career. When I wanted to chat to you today, I didn't want to just chat about my feelings about what a good doctor would be. So I actually asked my colleagues. So I'm currently working in a hospice at the moment. And so I asked quite a few of the nurses there, from senior nurses to right through to like healthcare workers and the physios, occupational therapists, like what do you look for in a good doctor? And there were some common themes, quite a few of them Dale has touched on already. Communication and communicating with the team was the biggest thing that came up when I asked people advice on what they thought. So the biggest one for the nurses was communicating the plans. So a lot of the time, due to like busy pressures on wards or in A&E, for example, a doctor might see a patient separately from the nurse, and then write the medical history, write up a plan, but then not communicate that plan to the nurse. And then they will pick up the plan either in the notes or on the computer a few hours later and see jobs or things that needed investigating or ordering or completing that could have been done a long time ago. And just because the doctor hadn't told them or communicated that through being busy or forgetting or not wanting to interrupt what they were doing, that can often lead to work frustrations. So being able to communicate plans and being able to communicate effectively is the most important in the opinions that I got today. Secondly, another one that came up was being approachable. So being approachable and being able to sort of take an aside in a busy shift, to listen, like I said, to what your queries or concerns might be about a patient. Because if you think about it, the nursing team might be with, depending on where you work, also completely depending on where you work, the nursing team is with the patient 24 hours a day. So they see the patient in the middle of the night, they see them in the evening when maybe the medical team has gone home. So they get to know the patients really, really, really well. So again, if they say that something isn't quite right with the patient, to be able to approach a doctor and feel like they're listening to you and listening to your problems or concerns about that patient is really, really important. With that as well, it also comes to listening to the team's opinions. So if a good doctor would ask the opinion of the team, so ask opinion from physiotherapists or maybe the nursing team, advice on what they think they want to do with the patient. And like Dale touched on, when you very first start out as a junior doctor, you're not as experienced in that field maybe as some of the nurses that have been there for 10 or 15 years. So to be able to listen to advice as well, maybe from someone a bit more experienced in that field, or even more experienced in just like the way things run, is really, really important. Another suggestion I got from one of my colleagues, I will just read directly because I thought it was quite a good one and I hadn't thought of this. So she said, I love it when a doctor needs something really simple like observations doing, or just to hang fluids, and they just do it if they can see you're really busy. And I really, really like that, because I was just like, that makes a brilliant doctor if they can see you're really, really busy, but don't ask very, very simple tasks that could take them 2 minutes if they finish the end of the consultation or if during the consultation they would just take a blood pressure. That is always very, very helpful. Following on from this, I didn't want to talk too much about examples of being a bad doctor, but it is just something to bear in mind, something that I've seen quite a few times during my career. The main thing that stood out for me is breaking bad news badly. And this sort of links into communication skills. And I know Mark at Medical Project has got an example of breaking bad news badly that I'm sure he wouldn't mind sharing later on a slide, on a link. But breaking bad news bad, you when you break bad news, you only get the chance to do it once, and if you do break it badly, you can that will stick with a patient forever. So being aware of the way you're coming across, being compassionate, empathetic, making sure you're in the right environment, making sure you're somewhere quiet or with the right people. All of these things are so important, and that would be my only bit of advice, my only sort of example of a bad doctor. So always being mindful of how you're breaking bad news to people. And yeah, they're my main points on about being a good or bad doctor from a nurse's point of view.
I think they're all really, really good points. And again, we see those common themes, which is communication and teamwork. Like you said, if someone just does a job that's a 60-second job, it's just helping the team, isn't it? And it's kind of not being that person that delegates things that don't need to be delegated, and recognizing that the team as a whole needs to get the job done. And it's not just that's a nurse's job. No, that's the team's job, and I'm part of that team, so I'll just jump in and I'll do that. So I think they're really, really good points. So
Yeah.
thank you very much. Yeah, I've got that link as well to the kind of the Breaking Bad news video. So I'll post that in the links as well while we're doing the Q&A. Cool. I think what we'll do is we'll just literally open it up to students, and I'll just kind of use the Q&A function, and I'll just try and throw some questions at you guys. We'll try and keep it around communication and around what makes being a good doctor. I know a lot of people will have questions about the application process. Well, this webinar, we just want to focus on the topic and not really be providing the application advice and guidance that we, have done in past webinars. Cool. So I'm just going to literally go from the top. This one has kind of 250 votes. So what should I focus on in year 12 if I want to apply to medicine? Dale, I don't know if you want to kind of help with that. What was kind of the big things at year 12 for you?
So I think having an awareness of what goes on, or having an awareness of how the medical structure in the UK is structured around, so how the NHS is structured from primary care to secondary care to tertiary care, and trying to get some experience in some of those settings. I know it's appreciated. It's very difficult to get experience in medical environments. However, there are a lot of places where the people are crying out for help. So, for example, you can do volunteer work at care homes. You can do volunteer work at nursing homes. You can apply to do work placements in GPs and in hospitals as well. So, I think having a look into alternate areas where you can get experience and getting as much experience as you can is key. And having an idea of what certain specialities are and how certain specialities are set up to a certain extent. So I think if you're interested pre-medical school about something like surgery or whatever, which is what I do, you could have a look at a few topics around that area. And it's a particularly good thing to have at your interview actually is a small few topics prepared in an area that you're interested in. So if you, for example, you said, I'm interested in surgery, this is something I was reading about, and here's some evidence that I'm looking at. So, there's a lot of different things you can do. Other things you can be involved in and actually it's a really underused topic, is things to do with information governance and clinical governance. Now that's something you can look up on the internet as well, clinical governance. And it's basically on how it's essentially about how trusts maintain quality and improve. So things you can be involved with in terms of clinical governance are, you can get involved with little audit departments and things like that. So there's audit departments inside hospitals. You can go and see if you can volunteer, or there's jobs involved there. Research departments that people can always get involved in, and it's all avenues to explore which show you thinking a bit more rather than just medicine, looking at the things that affect the quality and deliverance of the service. So I know that's something that always comes to my mind when people come and ask me what you can do. I hope that's useful.
Yeah, thank you very much. I think this is a great question here, and it's great to have both a doctor and a nurse to help answer this. So really, really common question that comes up, but why do you want to be a doctor and not a nurse? I guess a lot of it is kind of to do with skill set of each, and identifying yourself with one of those particular skill sets or enjoying a skill set more. Do you want to kind of talk through what your skill set is as a doctor and now a training surgeon? And then we'll kind of come to you, Isabel, and talk about what your main skills are. And that kind of contrasts and answers the question in a way.
So who wants to go first? Shall I go first, or do?
Yeah, go on. You can go first.
So my current skill set is very much based around technical skills, I suppose. So a lot of my day-to-day work is learning how to operate and performing very different types of operations, and that was always something that really I was very interested in pre-applying to university. I was always very interested in being a surgeon because I'm wanting to learn the technical skills, interested in the anatomy, and then also I suppose and one of the things that really swung me towards medicine rather than one of the other many professions within healthcare is having I suppose a larger bearing on decision making, and I think that's would be reasonable to say. For example, it's something that you really should consider in terms of, do you want to be having to make those decisions or not? Because it's not something for everybody. We do have to make difficult decisions. I mean, I frequently have to be involved in making decisions about whether we will operate or not operate on people, whether it's appropriate to operate, and these are all high level decisions with large consequences. And if that's something that you're happy to do, then that's something you should consider. But if you don't want the responsibility, it's another of making those decisions. Then there are other professions within healthcare that you can look to. That's not at all saying that nurses or other specialities don't make decisions. It's just I suppose the caliber of the decision making and the responsibility of the decision making. Essentially, when you're a consultant surgeon, when you're a consultant medic, the book really does stop with you to that extent. So if once you've made a decision, in many occasions, that's the you have the final say, and you need to be prepared to be able to make that decision.
Okay, and I guess what's the opposite side to that then, Isabel? What's the kind of the main skills and responsibilities that you kind of do in your day-to-day job then?
Yeah, no, I would agree with that, and I would agree with the sort of decision-making aspect of that. My day, and it's quite difficult to talk generally about the sort of skill sets of a nurse, because the types of nurse that you can be are so varied. So the skill set for like a scrub nurse or like a nurse in theatres is completely different to the skill set that I maybe practice in. And I know my skill set working in palliative care is completely different to when I worked in A&E. The main sort of things that I focus on in my day-to-day job now is breaking bad news to people every single day. And that's something that I've really had to practice and focus on, and really sort of supporting people in some of the most difficult days of their life, family and patients. I think my work at the moment it's a privilege. It's a privilege to work where I work and do the job that I do. You're focusing on sort of making people's lives better, even though they're sort of at the end of their life, and that requires you to be empathetic and compassionate. And I think those are the main sort of skills that you're sort of taught throughout your nursing career, depending on where you go. I wouldn't really know what to say in sort of how to choose which one is more suited for you. I think when you're applying which one would suit you best. However, I think for people that might be thinking about applying to nursing instead of medicine, is that I would just say that the role of the nurse is changing. And I know that you can grow and develop within your career to the point where you are sort of making those more difficult senior decisions alongside consultants, and I'm not too sure about surgeons, but they're not really the decisions you're having to make might be different, but are equally sort of like weight bearing sometimes as well. So yeah.
Just one other thing I was going to say is actually it's a good thing to think about actually if you want a situation or a career where you're really developing relationships with your patients and having a lot to do with the patients and the families, nurses often have a lot more time with specific patients than we do. Like Isabel said earlier on, actually, is my time with specific patients is often quite limited to a short consultation on a ward round or a review in A&E or going to see someone who's sick. And if you want to develop strong relationships with your patients, nursing is a fantastic way to be able to do that. Especially, I know the palliative care nurses like Isabel really impact people's lives and have big long-standing emotional connections with people's families, especially as well as someone is going through a dying process. And if that's something that you want to have that relationship with your patients, I'd really would consider nursing as an option, because I think you'll probably have more time to do that than to a certain extent you have more time with a smaller amount of patients. I mean, for example, as a general surgical doctor in my hospital, I cover when I'm on call, I cover multiple wards, A&E, theatres. So I'm covering a lot, whereas a nurse on the ward would have, it's normally about 6 to 10 patients, isn't it?
You're allocated, and you get to know those patients inside and out, because you do get to spend that time with them. And equally, I can appreciate how difficult it is sometimes not getting to spend that time with patients, and especially when you're going to see people that you might not have looked after that even that day. So then that's really where you do work together as a team to sort of make sure you're doing right by the patient.
Exactly.
A lot of questions about kind of breaking bad news as well. I think it's a topic that it kind of demonstrates your communication skills in the most challenging environment. So it's always something that students ask us about, is kind of how do you go about breaking bad news. I don't know if you just want to give some tips, because I guess being a palliative care nurse, breaking bad news is, a day, almost like happens every day for you. Do you have any kind of tips for those kind of communication settings, or those really, really challenging times?
Yeah, so there are always the basics that you will read about. So always making sure that you're in the right environment. So never sort of break bad news to people in the middle of a corridor, or if possible. It's not always possible, and I do appreciate that. And I have worked in situations where you do have to break bad news to people in an A&E setting that might not be the most private, but always try your best to make sure that you're in a private room. Make sure that you are sort of well versed in what's happened to the patient, and able to answer any potential questions that they may have. So don't sort of go in blind. Sort of know a background about the patient if you can, and what's happened. Don't talk, don't use sort of medical jargon is another one. Don't use complicated words, because people just won't take it in, especially if, for example, you're telling somebody that their loved one has died, and you're using the complicated reasons as to why they've died. They're just not going to register it or understand. But my sort of own personal bit of advice that I've found quite helpful in these situations is to try and make sure that the person that you're breaking the bad news to, you've sort of identified a support network for that person. So if you're telling somebody their loved one, or if you're about to tell somebody that their loved one is going to die, or has passed away, identify if there's somebody that could come and support that person that has just received that awful news. It's not always possible, but I have found it helpful to sort of be able to support that person as well.
Is there anything you kind of like add to that, Dale, as well?
No, I really, as a doctor, and sometimes I've been in situations where I've had to break bad news in A&E myself, and having a good basic background knowledge about what's going on, and trying to get as much information as you can before you actually go into that communication scenario is key. And it can be really frustrating for people, because you can have as a doctor a suspicion that what the pathological process that is going wrong will ultimately end up in someone not surviving from that process. And what you need to do is you need to make sure you've got all the information before you go into that scenario and inappropriately. So that's quite often hard to do. So, for example, you might want to get scans, you might want to get blood tests, you might want to speak to other members of the family before you have that conversation. And in an acute situation, that can be really, really quite difficult to manage that. I think the biggest thing for me is jargon, like Isabel said. If I said, you could say to someone, and I was going to say something medical there, but actually I don't think it's relevant to a certain extent. I could say something, that a patient wouldn't understand, and they'd go away not understanding that they ultimately had a terminal diagnosis or a bad diagnosis. So, what I found quite often useful is for example, if I was telling someone that they had a bowel cancer, for example, I'd often draw a diagram of someone's bowel and explain the anatomy to start off with, and explain the consequences of what we found and what it means. And that's usually the best way of dealing with something is ultimately describing in simple English what's going on. But one thing I did want to highlight is actually when you get to kind of through medical school and you've learned the language of medicine, it's actually really hard not to say it in a medical way. And that's a really, really big skill to think about. Actually, you need to learn to say things in a normal way, because you would speak to your colleagues who are often your friends and use the medical terms, and it becomes quite difficult to actually talk in a non-medical way, and you automatically speak in the language of medicine without knowing about it. So that's always something to bear in mind, and it's a useful way of dealing with that. Actually, is trying to do simulations and consultations where you're videoed. Obviously, you won't be able to do that in the emergency department, but it really does help you identify what you're doing, because you don't know half of the time what you're doing. You have to be able to see it yourself. So, for example, I video all my operations, so I can identify mistakes I've made intraoperatively. It's just all about that process of reflecting and identifying your issues. And if you can watch it back, you'd probably notice a lot of things about what you're doing.
Excellent, thank you. I'll take one more question from the students here. This is the top one, and it's more about the kind of the interview process. I know it's a little bit off topic from what we're talking about, but I think it's had kind of nearly 300 people have kind of voted for this. So I really want to just try and answer this one as the last question if we can. So they've asked, what makes somebody stand out in an interview and during kind of all the parts of the application process? I know that's not strictly what we're talking about this evening, but if there's any advice that you have for this kind of last question, it would be greatly appreciated.
So it's really difficult. It's really difficult because medical schools get hundreds and hundreds of personal statements that are essentially very similar. So to a certain extent, what you need to do is keep up with the crowd to a certain extent by getting a bit of experience. And the best way of standing out is an interview. So being prepared, having read around the topic, knowing current issues that are facing the specialities and the NHS to itself, knowing a little bit about political topics, current up-to-date research, having a bit of information about that, knowing a few things about information governance, like I mentioned earlier on, clinical governance, safety issues like the WHO checklist, and having a bit of an idea about all these things and being able to talk about them fairly fluently is ultimately the best way of standing out, in my opinion. So I've done a few interview panels and sat on a few various different things, and it's always for people who have read around the topics and have an idea about what's going on and are able to talk about it and look prepared are the people who do well. I think not looking prepared, not looking at current issues and not having ideas and kind of current issues, I think they always look like unprepared candidates. So that would be my piece of advice.
Okay, we're just coming up to kind of 8 o'clock now, so I'm going to ask you this question to both of you just as the final wrap-up piece. So what would your kind of one key piece of advice be for somebody that's going to make somebody a good doctor? I know they can't be a good doctor yet because they've got a long way to go, but if they've got that in the back of their mind and it sticks, and the first day that they walk to hospital and they're a doctor and they remember this one piece of advice, what do you think it would be? And maybe if we start with you as well.
So I would just go back to that first piece of advice, that it's just to look at your patient and just to look at your patient, listen to your patient, and you can't go too far wrong, I don't think, if you do that.
Excellent, thank you. And what would yours be, Dale? That kind of one piece that they're going to remember when they first walk through those hospital doors?
I think probably harness your curiosity with regard to medicine. So, you know, if you're interested in something, or you're interested in a patient's case, or you're interested in going to theatre, really, really try and experience as much as you can. And experience is ultimately knowledge, and knowledge will help you get through everything that you need to be able to get through. But don't leave any experiences letting you pass you by. I'd say go and experience everything you can. Go and speak to as many people as you can, and practice as many skills as you can, and just experience it to the best of your ability. That would be, if I could do my time again, I probably would have listened to that. I would have said that's probably where I'm coming from.
Okay, excellent. Yeah, thank you very much for joining us this evening, guys. I'm going to let you two go. Thank you for joining us. I'm going to paste the links to the students, so I'll sort that out with the students. But yeah, huge thank you for joining us this evening. It's been a great insight to have both of you here as well. So thank you for joining us, and we really appreciate it.
No
Thank you for having us.
Thanks.
Good luck,
Cheers,
everybody,
bye.
as well in your applications.
Yeah, good luck. Bye.
Right, I'm just going to grab all the links for the students. So if you give me 2 seconds, I'll paste them all into the chat, and then you students will wrap this up as well. Okay, so this one is the WHO checklist. So I'll pop this in the chat for you. That's the WHO surgical checklist. This is the GMC's good medical practice document. It's a really, really good document to read pre-interviews. We'll paste that in there for you as well. And then the last one was the Breaking Bad News scenarios as well. It's actually a video that's on our YouTube channel. But what I will do, I'll paste the link to our YouTube channel, and I'll tell you which video it is as well. If you give me 2 seconds, I'll just find out exactly which video it is. So there's a video on our YouTube channel which is about mock interviews. There's part 1 and part 2. And it's in part 1 and part 2, so you'll find that on that YouTube channel. If you haven't got those links in the chat, we'll put those links into the email that we send with a recording of this and the slides as well. So you should have everything from this evening. I think that's it. Our next webinar is in 2 weeks' time. I think Minnie will be back for that one. So we'll see you in a couple of weeks' time, and thanks very much for joining us, and have a great evening. All right, thanks guys.